Hey everybody, happy Wednesday. I have you update. Don't forget, we've got our new system going where you have this update to watch, and then you also watch the update for your department that you can find through your humanity training. And also we post those videos directly in the Slack channel for your department for customer care, resort, and for nurses and doctors. Okay, so to jump right in, this week I posted in two places, one on Slack in the general channel, and then the second through Humanity Message, that we have our Team Member of the Year survey up. I'd like everybody to take a few minutes this week and try and go and do your nominations by department there, please. We want to get those in by the 13th so that we can get everything tallied up, and we will announce our Team Member of the Year at our Christmas party on December 1st. And we'll have an RSVP for our Christmas party going out pretty soon. Speaking of Christmas, we are a good probably third of the way through our Christmas mission, which is the Operation Christmas Child. I know you know about it. We've been sharing updates as we go. The last count that I did, today's Wednesday, about an hour ago, like lunchtime, was that we have 39 boxes packed so far, but our goal is 100. There is good news though. I went and double checked the shipping schedule, and it's updated in some kind of way. So they've extended their shipping time. So that gives us more time to collect. As a reminder, get your family and friends involved. Share it on social media. A lot of people love this type of thing and are looking for a way to participate, and they can do it through us. Get a parent to go. I'm sure you guys can guilt them in. Get a significant other. Get your friends. Just get people involved, and make sure that you pack a box yourself. Some people have been bringing money by the office, which is good. We can put that towards shipping, but we can't shop for you. That's what we're asking you to do. The dollar store is kind of like the Mecca hotspot where you can get a lot of things and fill the boxes. Again, stay away from those do not pack items. I've posted those in Slack, and try and shop for a specific age group. There's a couple people who have done this a few times before who can give you guidance just to make sure that we get it done. I'm going to suggest that our deadline be to have all of our stuff turned in by next Tuesday, as in like after Tuesday, no more. And that'll give us 2 more days to reach the goal of getting those out to be shipped on time. Again, we're trying to fill about 61 more boxes. So if you haven't contributed yet, please try and commit to at least 1 box. It's about $10 worth of supplies, and it goes to an amazing cause a long way. Okay, the next thing that I wanted to share for everyone to hear is that periodically we get phone calls from other veterinarians or from clients who are looking for cardiac ultrasounds or echocardiograms. Those are 2 different things, and we have different charges for them. We send echocardiograms or ECGs out to a specialist. Some of you may know Dr. Strickland, who comes here. So here's the process that I want you to follow. Because it would be hard for you to determine which one unless a client specifically asks or a referring vet specifically asks, try and take a message for Dr. Bordelon or Dr. Patrick or Dr. Gordy, one of those 3, whoever you think is going to be available at that time, and they can help to determine what that pet needs. Dr. Gordy is very proficient in cardiac ultrasound, but he needs to know the history of the patient sometimes to determine if they need to go straight to the specialist or if he can do kind of that preliminary screening. We do have a charge in if you're looking just to determine what the fee is. There's the charge for Dr. Strickland, which you can find in Avamark, and then the charge for Dr. Gordy is under cardiac ultrasound. So again, I'll just kind of summarize that. If you're asked and you don't know, you can look for those 2 charges, and then ultimately you'll leave a message for Dr. Bordelon, Dr. Cutbirth, or Dr. Gordy Labe, and they'll get back to that client in time. Just choose which one is going to be available the quickest so that you don't have to keep the client or the referring veterinarian waiting. Okay, the next thing that I want to talk about is car exams. The concept is great. Our execution is pretty good but needs some work. So I wanted to give some specifications on that. Why would we do a car exam? Usually we want to do a car exam if we're trying to keep the patient who's potentially contagious out of the hospital until we determine what's going on with them and where within the practice we can move them, just to try and control the spread of disease, right? So the other reasons why we sometimes keep pets in cars instead of bringing them directly into the practice is because of aggressive pets or pets who don't settle well in the lobby and kind of create some disturbances to other patients who are waiting. Please know the difference in those two situations, and make sure if you're a customer care team member or a nurse who's working in that area that you fill the rest of the team in on what type of situation caused that pet to be waiting outside, because we'll handle them differently. Aggressive pets who wait in the car, that's an excellent idea. Or who aren't settling well and might disturb other pets, that's a great idea. But ultimately, when it's time for their visit, we want to bring them inside. And so nurses, you need to know to respond in a different way to those types of situations and not attempt to do your work outside, but bring them inside for that. You can use the side doors or the back doors for those things. I love the little door that's outside of room 5 and 6 as an entrance to get to that front hallway to manage those types of appointments. But it's probably not a good idea to try and examine those pets or get a history in the car. For contagious pets who are in the car, and we attempt to do our first exam, I'm suggesting that for those pets, just the doctor and one nurse go out right away to examine those pets and determine where to go from there. There's no need for a nurse to go and try and get vitals and get a history and then come back in the building and then go back out. That's the same type of spread of disease as them being inside. So here's how you would handle either situation. Communicate on what to expect, customer care team to the nurses, and then the nurse and the doctor immediately go out together, determine what's going on with the situation, and then bring the pet back in. But don't try and examine an aggressive pet in the car, and don't try and go back and forth from a car with a pet who's potentially contagious. Just be smart about what you're doing. We really want to try and reduce the number of occurrences of these car exams that we have and really feel out those specific situations. So think about it before you just schedule it. Think about what potentially could this pet have as far as a contagious disease. If they're coughing or if they're a young pet, I would say less than 10 months old, unsure about vaccine history or incomplete vaccine history. If they're having diarrhea, that definitely should be seen in the car because you're thinking parvo. So kind of think about the process and don't just settle on, oh, it's any pet with diarrhea or any pet who's vomiting that we're going to see in the car, because those are symptoms of many, many diseases, most of which are not contagious. So just kind of follow your instinct on that and don't jump to that conclusion right away. But do be cautious because we appreciate when it's done right. If you have questions, I would recommend talking to your supervisor and feeling that out, or talking to a more experienced team member before you settle on doing a car exam. I think that we might be doing too many of them and it might not be going very well, but I do think it's a great concept. So stay after it. Okay, that's all I have for today. Keep up the great work and be sure to watch your other update in your department channel. Thanks and have a great day.